Hello, I am Tu Kim Lam. Welcome to the medical news on SBTN from Washington, D.C. Spring is one of the most beautiful seasons of the year. While we enjoy watching beautiful flowers blooming and colorful scenery, many people have suffered the symptom of allergies that are caused by pollens. Thus, on this edition of the medical news, we will talk about allergies. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us the information and the latest medication for the allergies. Welcome to the Medical News Show, Dr. Tran.
Welcome to our shows and hello, Mrs. Lam.
Dr. Tran, we're going to talk about allergy today. First of all, can you share with our audience what allergy is?
Well, allergies is very common, very popular in the world right now. But what is allergy? Really, to understand allergy, we need to understand the immune system. Immune system is the system of the body usually to fight against any invaders, including infections and bacteria or any foreign body get into the system. These substance, these invader, we call allergen. And then when the body tries to fight back, they produce antibody. The fighting between the antibody and allergen causing the reaction we call an allergic reaction. So therefore, by definitions, allergies mean exaggerated response of the immune system of the body against the invader of the body.
Can you tell us what caused the allergies?
The cause of allergy, because right now we live in the world that mostly we can see the allergy everywhere. For instance, in the air, we see so many things beside the oxygen we need for survival. And secondly, the food, we have so many different food that may cause allergy, including peanuts and different kind of seafood. And thirdly, we have so many drugs and medicine that people take every day that may cause allergy. For instance, penicillin is well-known medication, the antibiotic that may cause very severe reaction and may cause death in the people. And thirdly is we always exposed to different kind of chemicals, including vegetables and on kind of trees and outside and garden. So I think it's the problem with allergies is very complex. And as human beings, we always exposed to something that may trigger some problem for our body.
So, can you tell us what factors in the air that cause the allergy?
In the air, I think is so important because we need to understand. For instance, it's springtime, we have pollens. And if you watch TV, you can see they count the levels of pollen almost every day during the season, especially spring season. Beside the pollen, you can see grass and weed and the dust from the air in the air. But for people really just live inside the door, I think inside the house we have so many different kind of allergic reaction causing by, for instance, dust mite from the carpet, from mold spore that we can see in the pictures, and different form of the allergen in the house that may trigger all kind of problem for the people, especially Asian people when we have a lot of cockroach in the house, and the trapping of these insect may trigger severe allergy, including asthma as well. And most people are not aware of that because the things inside the house may causing harm to the body. Yeah.
So there are so many children and also an adult that have the allergy in food. Can you tell us what causes the allergy in food?
Food is a very important source of the allergies in human being because we eat so many different kind of food, including like peanuts and also cause and severe reaction called fatal reaction. Therefore, the airline, they don't want to provide peanut for the customers anymore because they're afraid that it may cause some problem for the customers in the air. And medication, very important to remember. In the past, we had to deal with penicillin, the first antibiotic come out in the market. but then they're causing severe reaction and people may die from injection of penicillin. And right now we have so many, about 1,000 different kind of medication that may trigger some reaction, either from small to big and severe reaction called fatal reaction from these medications.
So there are many people get the skin allergy. Can you tell us what caused the skin allergy?
The skin is a problem because the skin always exposed to different things, and in the old days we're not really exposed to too much chemicals. But nowadays we're exposed to a lot of things like cosmetic and metals and jewelries, and everything can cause some reaction to the skin. But outdoor, need to remember during this season, we need to pay attention on the thing that we call poison ivy. If you look at in the pictures on the screen, you can see. Try to remember and identify these poison ivy, because when you touch them, it causes severe reaction of the skin. It's take some time to cure them with the medication. Besides that, the cosmetic and the glove we wear with the latex gloves also causing reaction for the hand as well.
Dr. Tran, why some people allergic to something and some people have no problem with anything? There's no allergy.
The question already answered, because we know exactly, because people have severe reaction. Usually they have the gene relate to that and relate to the father or the mother. If the father have problem, usually 25% of children may carry that kind of gene. But if both of them have the allergy, then the majority of the children will get the allergy with certain kind of different things in their life. Secondly, since we're talking about environment, even though the people have carried some kind of gene about allergy, but if they're not exposed to that environment, they may not develop some kind of severe reaction. For instance, one person come from Vietnam to live in Washington, D.C. In the first couple of years, they really have no reaction, no allergy with pollen. But after 3 years, they may develop the severe reaction to pollen, because they carry the allergic gene, but then they expose multiple times with the pollen. Then the body react, produce more antibody against pollen, and finally they have severe reaction because the body tried to get rid of the pollen, but they couldn't do it, and they're causing more damage to the body.
So now let's talk about the symptoms. Once the person have the allergy, what kind of symptoms do they have?
The symptom is very easy to recognize, because people may have itching eye and runny nose and irritation of the throat and sneezing. Some people will have severe reaction, may call asthma, short breath, and wheezing at night. So a symptom is easy to recognize. Most people, they can really make their own diagnosis about the allergy. And for the other things, and we need to be careful for the food, they call itching and hives. This means you can see redness on the skin, and skin rashes when you contact with some chemical that causing reaction. And be careful, because these reaction can be so severe. So if you run into the problem with severe problems, short breath, you better to go to to see the doctor or get help from the urgent care or hospital.
So, so right now, what kind of method that are currently used to make a diagnosis of allergy?
We have so many different kind of methods we can use to identify exactly the allergen. The principle that is, we try to identify the allergen, mean like pollen or eggs or some certain kind of food. And then we inject that kind of allergen into the skin by using either the crest on the skin or the needle to the injection. Or if the patient refuses to have the needles, then they can use the patch that you can see on the screen. A different kind of testing they can use. And then mainly, if you see the redness around that area, that causes positive reaction. If the skin is look normal, this means negative. And from that, they can identify exactly what's causing the problem. Sometimes people have to get about like 20, 30 different kind of skin testing to identify exactly how many allergens they really develop reaction to. But nowadays, with the new technology, with the advance of the lab, I think we just need some blood drawn and then able to identify most of the allergen that the patient may develop because just use simple blood tests. Hopefully, with the technology nowadays, in the future, we don't need to do the old way to testing anymore. It's just draw blood to get the identify these allergens.
So what kind of treatments are being used and how effective are these treatments?
I think most people are aware that we have offered different kind of treatment in the past until now, different oral medication. Right now, you can see and you can find over the counter like Claritin, Allegra, Benatrix, and Zyrtec. These are very good medication to fight against allergy. But the problem is beside the nasal spray and the eye drops, for severe cases, these medication may not help. And then we have to rely on stronger medication. There's two different methods to use that. The first one, the injectable medication called methylprednisolone. The methylprednisolone will suppress the immune system and help the patient really overcome severe allergic reaction seasonal, at least for 1 or 2 months. They have some side effect because they suppress the immune system. The body may have a little bit weaker defense against infection in the future. But if we use only 1 or 2 shots a year, I think the side effect could be very, very small. The second method we use for long term, they call immunotherapy. Immunotherapy has been in the market for so long. And people try to desensitize the people against certain kind of allergen by using the allergen in small amount concentration and introduce to the skin of that patient slowly every week and increase the amount of the allergen in that solution slowly in 2 or 3 years like that. Then hopefully the patient have very mild reaction to the allergen. Why is that? Because when you introduce that way, the antibody really get knowing the allergen and they don't react strongly like we certainly expose this patient to large amount of allergen. So that we call desensitization or a form of immunotherapy. Nowadays, people try to use oral immunotherapy. I mean, instead of taking the shot every week, is so time consuming. People can take oral immunotherapy at home by using the oral form. And hopefully in the future, I think is when the advancement of on the technology, we have better medication we can use just orally instead of injections.
So what is the latest medicine that you use right now?
The latest right now, really, we have the new medication called Xolair. Xolair, they call it omalizumab. That's the immunomodulator. That's the medication that really to modify the immune system, to suppress a little bit the immune system against not fighting too strong. These medications come out in the market for some time already, but recently, the National Institute of Health and Allergy Infectious Disease, they come up with the conclusion this medication is very effective to decrease the numbers of the asthmatic attack and decrease the levels of the allergic with the nasal allergy or the skin allergic reaction. So hopefully in the future we use this medication more in the future, but unfortunately it's come with a form of injection. So therefore it may limit the uses for people they don't like needle. But I think it's with the new medication is open up new kind of treatment for people who suffer from severe allergy for years.
Before closing the show, would you give some advice on how to prevent the allergy?
To prevent allergy is very complex issues because we try everything, but it's sometimes difficult because the allergen in the air. It's hard to avoid the pollens in the air, especially in springtime in Washington, D.C. Therefore, try to stay indoor when you go out to protect your eye, your nose, and try to avoid as much as outdoor activities during the big season when the levels of the pollen is so high in the air. The secondly is try to reduce the allergen indoor, I mean in the house, by clean up the carpet. Try not to use the carpet if you could, and replace by the wooden floor, or clean up the bathroom and the basement where all the mold will grow in this area, especially for the Asian population. I think we need to be careful about the cockroach, because the dropping of these insects may trigger asthma as well and severe reaction. And not many people are aware that these tiny little insects can trigger a lot of disease for human beings.
Thank you, Dr. Tran. That is all the time we have for today. Thank you for joining us.
Yeah, thank you again for follow our shows and watching our shows. And again, thank you, Mrs. Lam.
Thank you, sir. That was Dr. Sang Tran, who just shared with us the information as well as the new medication for allergies. We hope that the information provided by Dr. Tran today has shed more light on the disease. That is all the time we have for the Medical News Show today. Thanks for watching. I am Tu Kim Lam. We'll see you the next time on the Medical News. Until then, have a blessing one.